Today, in accordance with international endocrinological protocols, surgical removal of pituitary adenoma transnasally remains the main treatment option for most patients with acromegaly. In some cases, the surgeon cannot remove the entire tumor. Because of this, after the surgery, the level of the hormone will remain elevated. In addition, in the past, when surgery was done using X-rays, patients often lost their vision. Now there is gamma knife radiosurgery. After the operation, the reverse development of the disease can be observed. Today, new methods of radiation therapy, such as stereotactic radiotherapy or radiosurgery, are becoming increasingly important, providing high-exposure precision and efficiency of radiation techniques. This allows the narrowing of the size of the irradiated field and reducing the duration of radiation exposure. Radiation therapy is indicated for the ineffectiveness of surgical treatment, the impossibility of performing the surgery, the presence of contraindications to medical therapy or its ineffectiveness. Radiation therapy helps to slowly lower growth hormone levels, but to get a tangible effect, a long course of therapy may be required. Conservative therapy may be recommended for patients with severe manifestations of acromegaly, requiring preparation for surgical intervention, or for patients who cannot undergo surgical treatment due to severe endocrinological complications. Pharmacological therapy is used along with other treatments. To reduce the production of growth hormone or block its effects on the body, the patient is prescribed somatostatin analogs, that is, synthetic forms of the hormone that is produced in the pituitary gland. These drugs prevent the pituitary gland from making too much growth hormone and help lower its levels quickly. In many cases, after taking them, the tumor decreases. As part of pharmacological therapy, antagonists, growth hormone blockers, are also used. This class of medications blocks the action of growth hormones on body tissues. It is especially effective for patients who have not been helped by other treatments for acromegaly. Growth hormone antagonists can normalize insulin-like growth factor levels and relieve symptoms, but they do not lower the level of growth hormone and do not help reduce the tumor size. Based on the information we have, we can conclude that acromegaly is a serious disease that can seriously undermine health and significantly complicate the patient's life. Acromegaly significantly affects the appearance, distorts the body and face. This often leads to excessive attention of others, because people with an unusual appearance, different from the majority, draw stares that unfortunately are not always friendly. Patients with acromegaly often suffer from mockery and even discrimination. People with this disease are not always able to get a job due to facial deformities. A lot, of course, depends on the attitude to the problem of the person him or herself, as well as on the support of his or her loved ones. Positivity and optimism allow the giants to live life to the full, create families, raise children, and fulfill their dreams. Prejudice and misunderstanding of others are due to a lack of information about the disease. After all, appearances are deceiving, and people with unusual and perhaps sometimes frightening appearances are often kind, funny, and smart. They can be great friends and wonderful parents. The most famous and flamboyant giant was the world-famous wrestler Maurice Tillet, or Taille. Maurice was born in 1903 in Russia to a French family who returned to France after the Revolution. In his boyhood days, the boy was an ordinary child with an angelic appearance. A cute child until the age of 17, had no problems with his health, but then suddenly began to notice that something was wrong with his body. His arms and legs began to grow as if by themselves. His head also increased in size. Facial features changed literally over a few months. Doctors diagnosed him with acromegaly. After a few years, Maurice looked like a giant. The guy was very smart and studied well at school. He dreamed of becoming a lawyer, but gave up his dream due to illness. Maybe with such a face I could have become a lawyer, but my voice, like a donkey's roar, was simply impossible to listen to, Tillet said. After being unemployed for some time, the man went to the French Navy, where he served for 5 years as an engineer. After that, he briefly worked as a doorman at a film studio, sometimes even appearing in small episodes of horror films. According to some reports, Maurice played the role of Quasimodo in the film The Hunchback of Notre Dame, but the movie was never released, and over time the film disappeared. However, he did not give up on his life, but decided to use his disability as an advantage. In search of a new image that would match his non-standard body, Tillett left for the USA, where he used his unusual appearance in the only way possible. He became a professional wrestler and acted in the ring as a giant, terrifying his opponents. The audience screamed like crazy when Tillett, in the form of a villain, fought the enemy to earn a living. He came to the title of world champion already with the professional pseudonym Ogre. In 1940, Maurice became the champion according to the American Wrestling Association. Despite his appearance, he was called the French Angel for his sincerity and kind nature. Maurice was also distinguished by phenomenal intellectual abilities. He was fluent in several foreign languages, wrote stories and poems, and his favorite pastime was playing chess. Maurice won many titles and awards, and his unusual appearance only added to his popularity among sports fans. Gradually, he came to terms with his appearance. All subsequent years, he treated it with humor. For example, posed in a paleontological museum next to a statue of a Neanderthal man, and most of all made fun of the resemblance. He never took offense when he saw the increased attention of people. With an eerie appearance, this ogre was a kind giant inside, and all the acquaintances understood this very well. After his career began to decline, Maurice began to lead the life of a recluse. He spoke only with a few closest people, and in 1955, Tillett died of heart disease. One of his friends made 3 death masks of Maurice, which are displayed in museums. Apart from that, the image of Maurice Tillett is rumored to be the prototype of the image of Shrek. So to a certain extent, Tillett's dream of becoming an actor has come true. Everyone who has seen a photo of Maurice Tillett exclaims, "It's Shrek!" Indeed, the image of Shrek is surprisingly similar to the famous giant Tillett. 10 years ago, the cartoon character Shrek received a star on the Hollywood Walk of Fame, and also entered the 100 most recognizable characters of our century. This good-natured character took the fancy of both children and adults. They say that his appearance was copied from the famous French wrestler Maurice Tillett. One cannot claim 100% that it was Tillett who was the prototype of Shrek, but it is known for certain that a poster with his photo hung in the DreamWorks studio. The cartoonists don't admit to copying, but the resemblance is obvious. The artist who invented Shrek must have known about acromegaly. True, the ears do not fold into a tube from this disease, but everything else is exactly the same. Thanks to the image of the ogre Shrek, who is not at all scary, but kind and funny, not ashamed to be who he is, we understand that it's not about appearance at all, that beauty is inside a person. We must learn to look at people with an open mind and be able to discern the beauty of the soul under the guise of illness. Maurice Tillett was not the only famous giant. Robert Pershing Wadlow was born in 1918 and lived only 22 years. His height of 272 centimeters was recorded by the Guinness Book of Records. Wadlow is officially the tallest person to have ever lived on the earth. His parents and younger siblings were of average height. Robert was an ordinary child until the age of 5, but then he began to grow rapidly. At 8 years old, his height was 188 centimeters. At 10 years old, he was 198 centimeters. Robert could already carry his father in his arms. At 18, his height was 254 centimeters, and the length of his foot was 49 centimeters. By this time, Robert was already a celebrity and America's favorite. The guy studied well at school, entered the university at the Faculty of Law. At the same time, he toured and constantly took part in various tours and shows. The public simply adored him and called him a gentle giant. Over time, his health deteriorated, and he could hardly walk with the help of crutches. Once, a crutch rubbed his leg. Infection and sepsis developed. Doctors tried to save him by transfusing blood and performing surgery, but Robert Wadlow died at the age of 22. 40,000 Americans attended the funeral. His grave was concreted so that no one could steal his body. His monument is 2 times higher than the standard in the cemetery. The gentle giant lived a short but very bright life, becoming America's favorite.